Welcome again. As a woman, there are what we call normal processes. And one of these is if in the productive age is menstruation, monthly period. And monthly period happens in a cyclic manner. Every person has their own cycle. Some have a cycle of 21 days, or every 21 days they get their period. Every 21 days they get their period. Some get it after every 28 days. Some get after every 30 days. Everybody has their cycle. What is considered normal is between 21 days and 35 days. The upper limit may differ depending on where you are reading your literature. There is what you know as your normal menstruation. It could be lasting 3 days. It could be lasting 5 days. It could be lasting 7 days. And you could be using a number of pads, let's say 1 pad a day, 2 pads a day, maybe 3 pads a day. And there is a pattern in which that you know your menses come. So they come and probably they soak within 6 hours. A pad is soaked up and you want to change it. When these patterns change, so from 21 days cycle, you're finding yourself having a monthly period every 14 days or 12 days and menses come back. Not normal. From monthly period that usually lasts 3-5 days and then suddenly they're lasting now 12 days, 21 days, etc. For 21 days, you're continuously bleeding. Not normal. If you're used to getting 2 pads or 3 and suddenly the pads now becoming, you're using more pads than usual. From 3, you're now using 5, 7. Not normal. If following the end of monthly period, you still have some bleeding happen in between before the next monthly period comes, not normal. What am I trying to say? That we need to be in a place where we know what is our normal. And from that, it is possible to know what is not normal that needs you to seek care. If your menses were never painful, or the pain was, the cramping pain was very minimal, and suddenly the cramping pain is overboard, you have to use pain medication, you have to miss going to school or miss going to work, not normal. Please don't sit at home. Don't sit at home. Some of these things can be caused by conditions that can actually be treated if we found them early. And among the very common causes, it doesn't matter the age group, uterine fibroids or the growths that are found from the muscle cells of the uterus. Something called adenomyosis, which basically means the presence of the special cells that are meant to line the inner part of the uterus being found deep inside the muscle wall of the uterus, may be a cause. If the menses were never painful and suddenly they are now extremely painful, please seek help. And so the call for today is for us to know what is our normal and enable us to identify what is not normal, to create a trigger to enable us seek care. Talk to your gynecologist. Thank you.